नमस्कार मेरे प्यारे दोस्तों। वेलकम माय डियर फ्रेंड्स। माई सेल्फ प्रोफेसर डॉक्टर राजेंद्र रघुवीर देशपांडे would like to welcome you all in my Ayurveda Academy YouTube channel. मेरे प्यारे दोस्तों, as you know that Dr. Deshpande is MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 922681060. मेरे प्यारे दोस्तों, today we are going to see the special topic from Ayurvedic surgery topic or Ayurvedic surgery subject, which is also called as Shalyatantra. In this subject, there is a particular topic which is very important for the examination as well as for the medical practice. Ashtavidha Shastrakarma. Ashtavidha Shastrakarma, 8 types of the different methods of surgery in Ayurveda. So let us start to discuss about Ashtavidha Shastrakarma. According to the Sushruta Samhita, there are 8 main surgical procedures known as Ashtavidha Shastrakarma. As you know that we have the big 3 compendia in Ayurveda: Charaka Samhita, Sushruta Samhita and Ashtanga Hridaya, written by Vagbhata. In this, Charaka Samhita is said to be the master text of medicine, internal medicine, that is Kaya Chikitsa subject. Similarly, Sushruta Samhita is supposed to be the best reference book for Ayurvedic surgical procedures. Sushruta, this particular surgeon of Ayurveda, is also recognized by the modern surgery pathy and surgery department, and in the surgical books of modern science, they have explained Sushrut as a master of surgery, because at that time he has done even the plastic surgeries in addition to the normal surgeries of tonsils and hernia. My dear friends, let us see which are these 8 main surgical procedures explained by the Sushruta. First is I can move the cursor on the screen so that you can identify. First is a Chedana, that is excising or removing. I think I should take the help of some special, what you can say, the facilities available here. So I would like to take this facility and let us see how it works. I think I should go for that, and then I should select spotlight, and I can select the color, for example, here. And yes, here you can see now this is a spotlight. My cursor is moving with the spotlight. So Chedana is excising or removing. Bhedana, Bhedana, dividing and separating. Lekhana, Lekhana, scraping. Vyadhana, Vyadhana, puncturing or piercing. Eshana, Eshana, that is probing or searching. Aharana, Aharana, pulling out or extracting. Aharana. Visravana, that is drainage or draining. And Shivana, that is suturing. So these 8 names the students must remember because they can be asked as a LAQ. Long answer question. This question is very common. Write down Ashtavidha Shastrakarma. Even one single process from 8 procedures, you may be asked for the SAQ or short answer question of 3 mark or 5 mark. For example, explain Chedana or explain Bhedana, explain Lekhana, explain Vyadhana. So these are the small questions prepared from the LAQ. My dear friends, these 8 names are very important. You should remember or you should learn by heart. याद करने की कोशिश कीजिए. छेदन, भेदन, लेखन, व्यधन, एषण, आहरण, विस्रावण, शीवण. Sanskrit names. I repeat 2 times for you. Chedana Bhedana Lekhana. Chedana Bhedana Lekhana Vyadhana. Eshana Aharana Visravana and Shivana. Shivana. Chedana Bhedana Lekhana Vyadhana. Eshana Aharana Visravana and Shivana. In English, it can be translated Chedana means excise, tonsillectomy, Chedana. Bhedana, dividing or separating. Lekhana, that is scraping. Vyadhana, that is puncturing or piercing. Eshana, that is probing or searching. Aharana, extracting or pulling out. Visravana, that is keeping the drain in the surgical wound. And Shivana, these suturing. So some are the Sanskrit words and they are translated in English. Let us start to see each one in detail. Shastra Karma Vyapad. Shastra Karma Vyapad. Vyapad is a complication. Vyapad is a complication. So first complication, Hina. That means if you are doing Hina Chedana, that is inadequate Chedana. Then Atirikta. Atirikta, cursor, please. Yes. Excessive. That is Atirikta Visravana. Unnecessary draining. Atirikta, excess. Tiryak, irregular. Tiryak, irregular. For example, Tiryak Shivana. Tiryak Shivana, suturing. Atma Gatra. Atma Gatra. Can you see the cursor? Red. Accidental. That is Atma Gatra Bhedana. Unnecessary accidental puncturing. So let us move further. Shastra Karma Vyapat. Vyapat is a complication. These complications occur if the surgeon uses improper instrument either due to ignorance or greediness. Improper utilization of the instrument. Then being instigated by the enemy. Some enemy has provoked him and asked him to do the wrong things. Then sometimes if the surgeon himself is because of the fear or the confusion or due to other impairing factors. So these are the things that can cause the Shastra Karma Vyapada, that are the complications. So first part goes to the wrong instrument. Second is because of the fear. Second is a confusion, and some other factors are also there. So let us move further. Ashtavidha Shastrakarma. First karma, Chedana Karma. Chedana Karma is a surgical procedure in which a particular part of the body is removed. It may range from excising the small structures like skin wart or the mole up to the amputation of the whole limb. Amputation of the whole limb. Total limb is cut off. Amputation of the whole limb. Now, what are the Shastra and Anushastra which can be used for Chedana Karma? That is Mandalagra, then Karpatra, then Vidhipatra, then Nakhashastra, Mudrika, Utpalapatra, Ardha Dhara Shastra. So these are the having some specific sharpness over there. They are called as a Shastra. Now, which Anushastra can be used for Chedana Karma? That is a Tvak, Sara, then Spatik, then Kats, Kurvind, Nakh, Agni, and Kshara. These are the Anushastras which can used for doing the Chedana Karma. My dear friends, some lectures are typically based on the information given in the Ayurvedic Samhita, that is Sushruta Samhita. So you can find many of these words are mentioned as original Sanskrit words. So some lectures or some videos I am going to prepare with the comparison of the Shastra or Anushastra with the modern names. So at that time, you will understand the meaning of each and everything. For example, Vriddhi Patra is like a scalpel. But for each and every word, right now, I am not going to translate. So one of the best example of Chedana Karma is removal tonsillectomy. Tomy means to cut and to remove. Okay, next. Now, Chedana Karma Yogya. Yogya means proper indication. Who is fit to get the Chedana Karma? In which Vyadhi, in which diseases we should do the Chedana Karma? That is Yogya. First is a Bhagandar, fistula in ano. Then Kafaja Granthi, that is glandular swelling. Then Tilak Kalak, these are the Sanskrit words, and in the bracket, comparative modern words. This is Mola. Arbuda is a tumor. Vrana Vartma or Nadi Vrana, that is Arsha or the piles. Then Charma Kila is a skin wart. Then Asthi Mausagata Shalya. Then Jatumani, that is hemangioma. Then Gala Shundika, that is uvulitis. Necrosis of the snayu, necrosis of the mouse, necrosis of the sira. Valmika, that is Madura foot. In this, we have to do the Chedana Karma. Then Shataponaka Bhagandar. Then Adrusha, that is palatine inflammatory swelling. Then Mausakanda, that is keloid, that is also called as a Adhimaus. So these are the indications, these are the diseases where Ayurvedic surgeon do the Chedana Karma. Let us move further. Now we are talking about, yes, Bhedana Karma. Bhedana Karma is the surgical procedure to divide or to separate the tissue to open a structure for achieving effective drainage or adequate removal of the underlying structures. So which instruments that we are going to use for Bhedana Karma? So here is a list of Shastra, that is instruments: Vriddhi Patra, Nakh Shastra, Mudrika, Utpala Patra, and Ardha Shastra. And which are the Anushastras that we can use? Tvak, Sara, Spatika, Kats, Kurvind, Nakh, Agni, and Kshara. They are used for the Bhedana Karma. My dear friends, again, Yogya. Who is the appropriate person? Which are the diseases? Which are the indications where the surgeon can do the Bhedana Karma? First is a Vriddhi. We have to separate, cut, incision and drainage, incise and drain. So Vriddhi is abscess, then Vataja, Pittaja, Kafaja, Granthi, like a tumor. Visarpa, Vriddhi, that is hydrocele. Then Vidarika, that is axillary or inguinal lymphadenitis. And then Prameha Pidaka, that is carbuncles. Okay. Then in the Shof, especially Stanaroga, we have to do the Bhedana Karma. Then Ava Manthaka or the Kumbhika, that is the diseases of the eyelids. Then Anushai, that is the scalp inflammation. That is Vrinda, that is throat tumors. Then Pushkarika and allergy, that is the Kshudra Rogas. Then Talu Danta Pupputa, that is Tundikeri, means tonsillitis. Tundikeri is a Sanskrit word. English meaning is a tonsillitis. Gilayu, that is pharyngeal swelling. Bastigat Ashmari, that is vesical calculus. In all these conditions, we have to do, or Ayurvedic surgeon do the right Bhedana Karma amongst the Ashtavidha Karma. Okay, let us move further. Third is a Lekhana Karma. Lekhana Karma is the surgical procedure to remove the tissue by scraping. So which are the Shastras or the instruments that we are going to use for Lekhana Karma? The first is a Mandalagra, then next is a Karapatra, and then third is a Vriddhi Patra. Then which Anushastras can be used to do the Lekhana Karma? One can use the caustics, that is Kshara, Gojiva, then Shefalika Patra, and Nakh. Now, of course, everywhere we are writing the definition, Shastra, Anushastra, and Yogya. Yogya means the indicated diseases or indicated problems. So, where we can do the Lekhan Karma? First is a Rohini disease, that is diphtheria. Also, Medaja Granthi. Then Kilas, that is leukoderma. Upajivika, that is sublingual inflammatory swellings. Dant Vaidarbha, that is Adhijivika, adenoids, Arsha, and Mandala Kushta, then Mausakanda and Mausa Unnata. See, in all these conditions, we have to do the right Lekhana Karma. Now, fourth problem is Vyadhana Karma. Vyadhana Karma is the surgical procedure to puncture or pierce a structure. So let us see how we can do this Shastra. Which Shastra can be used for the Vyadhana Karma? One is a Kutharika, then Vrihimukha, then Ara, then Vetasapatra, Eshani, Kushapatra. These are the things that we can use for Vyadhana Karma. Then which Anushastra we can use? Tvak, Sara, and Karira. These are the two things which can be used for Vyadhana Karma. Now, which conditions are indicated to do the perform of Vyadhana Karma? Number one is Mutra Vruddhi, that can be compared with hydrocele. Then Pakva Raktaja Gulma, here also we do the Vedana Karma. Dako Dar or ascites, very common finding. There we have to do the peritoneal tapping, and that is nothing but the Vyadhana Karma, peritoneal tapping to puncture the abdominal wall and to drain out the internal fluid. And also the Visarpa, some blisters are there, you have to do the Vyadhana Karma. Next, fifth one is Eshana Karma. Eshana Karma is the surgical probe. To probe, for example, here, probing. It looks bad, but I am showing you, putting something inside. Eshana Karma is the surgical probing procedure. And naturally, what instrument is needed? Eshani, a hollow type of pipe-like instrument is needed. That is called as a Eshani. Anushastra, that is Karira, Bala, and Anguli. Anguli. This can be used for the Eshani Karma. Now Yogya, where we can do the Eshana Karma. Number one is a Nadi Vrana. For example, fistula. In fistula in ano, we always do the Eshana Karma before the fistulectomy. Okay. Then next is what is that Vrana? Shalya Vrana. We have to take out that particular foreign body from the wound, and we do the Shalya Vrana, probing type of action. Then Margi Vrana, going upward direction. Hollow track is there, then we have to do the Eshana Karma. Next, sixth one is Aharana Karma. Aharana. Aharana Karma is the surgical procedure to extract a structure from the body. So which instruments we are using? One is a Badisha Yantra. Badisha. Then Danta Shanku instrument can be used for Aharana Karma. Then Anushastra are of course the Nakha and the Anguli. You must be knowing that when the child is not properly delivered, if there are some complications, some forceps is used to take out that particular fetus. So that using of forceps is called used as a Aharana Karma. Now, where we have to do this Aharana Karma? Yogya condition, proper disease or proper health problem. Number one is Mutra Sharkara. Whenever there is a calculus, we have to take it out. Calculus. Danta Mala. Here, tartar. Then Ashmari. Then Karna Mala. Here, wax is there, and we have to use the wax hook to remove the wax. So, this particular Karna Mala can be taken out with as a Aharana Karma. Then Shalya, Mudha Garva. Just now I have explained you when the child has been obstructed in the path, then that child is taken out with some forceps delivery. That is called as a Mudha Garva in Ayurveda. Then Gudha Varcha Nichita, accumulated fecal matter in the rectum. Doctor has to put the hand close and with the fingering that stools has been removed when they are too hard to pass out easily. So that manual removal of the hard stool, it is also aharana karma. We will go further. Seventh is a Visravana karma. Visravana karma. Visravana karma is the surgical procedure to drain the liquid from a particular site. To drain a liquid from particular site. Shastra, which Shastra are using? Kusha Patra. Then Ati Mukha, Shara Mukha. Ati Mukha and another is a Shara Mukha. These are the grass. They are similar, like looking like a grass. Then Antara Mukha. Then Tri Kurchika and Suchi. These are the different things that we are using to take out the fluid from the body. Anushastra, we can use the Jalauka. Yes, Jalaukavacharana, application of leeches as a Rakta Mokshana. Whenever the person has a lot of problem with the skin and Pitta dosha, so there are different things. For example, piles is there, psoriasis is there, herpes zoster is there. And so that particular accumulated impure blood has to be taken out with the Panchakarma called as a Rakta Mokshana. And in that Rakta Mokshana procedure, we used sometimes leeches or the Nirvisha Jalauka. Okay. So Nirvisha Jalauka are used for the Visravana of Dushita Rakta. Then next is a Shefalika and last is a Shaka Patra. These are the Anushastras that we use for the Visravana Karma. Now, of course, as like every time, we have to see which diseases where the Visravana karma can be done. So Yogya, optimal or the proper person or the proper disease. Selection is very important. Which type of the karma that we have to follow is depends on the indication. So number one is Vidradhi, like abscess. In abscess, we do the incision and drainage. That drainage word is like a Visravana. Then Kushta, different types of skin problems. Then Eka Doshaja Shof. That means if there is a local swelling or inflammation, even the Visravan can be done. Pali Roga, that is diseases of the ear lobule. Then Arbuda, tumor, benign or malignant. We can do sometimes Visravana. Then next is a Visarpa, that is like erysipelas or cellulitis, Granthi, then Upadamsha, then Stanaroga and Vidarika. These are the different diseases where we can do the Visravana. Sushira, here, porous gum, then Galashaluka, that is pustules in the axillary region, here. Then Krimidanta, dental caries, Danta waste, that is gum hypertrophy. Upakusha, that is gingivitis. Shita, Shitada, that is the spongy gum. Sitada. Then Danta Puputa, Pittaja or Raktaja or Kafaja, Oshtharoga, lip problems, and Kshudra Roga, that is again the skin problems. So here in these conditions, Visravana Karma can be done. Now, next is a Shivana Karma. Shivana Karma is a surgical suturing procedure. What is the Shastra? Of course, the needle and the thread, that is Suchi. Needle and the thread. What is the Anushastra? Bala. Required material for Shivana. Number one, Sukshma Sutra, that is fine thread. Here you can see. Then, that is Ashmantaka Valka, that is bark of Ashmantaka tree. Then Shana, that is thread of the Shana. Then here the silk thread can be used. Then tendons can be used. Hair bal, hair can be used. And fibers of the Murva and fibers of the Guduchi can be used for the suturing purpose. Okay. Now, Sivana Karma Yogya, diseases which arise from the Med, which have been incised and scraped. That are, we have to sometimes do the suturing over there. Sadyo vrana, whenever there is accidental wound, many times after removing the foreign bodies or the sand, dust, etc., and proper irrigation with the Trifala Kada, etc., that wound can be sutured because that is a open wound and Sivana Karma is indicated. Vrana located around the movable joints. There also we have to do better the suturing. Repair of the wounds on the head, on the ear, on the nose, sides of the neck, loops, arms, legs, abdomen, anal canal, genitalia, and scrotum. In this repairing of the wounds in any part of these parts of the body, then you have to go for suturing, Sivana Karma. Now, where you should not do the Sivana karma or no suturing should be done, number one, Sivana, that is suturing, is contraindicated in the wounds which are caused by. If Kshara wound is there, don't do suturing. If Agni Vrana is there, you don't do the suturing. Then Visha poisoning, poisonous material has been there, don't do the suturing. It is also contraindicated if there is a antah lohita, that is the blood clot inside, or antah shalya, foreign body is still inside, then never, never, never do the sivana karma. Now, what are the types of the sivana? That is the types of suturing material and procedure. Number one is velitak, that is a continuous type of suturing. Then Gopanika, that is a blanket type of the suturing. Tunna Sevani, that is a subcuticular type of suturing. Then Ruja Granthi, that is interrupted type of the suturing. Now, Suchi Prakar, types of the needles. Number one, Vritta Suchi, that is round body needle, is used where the tissue is very thin. At joints, the needle should have the circular tip and have the 2 angular length. Then next is a Tristra Suchi, that is triangular cutting needle used where the tissue is more thicker. Needle should be straight and have a triangular tip and have the 3 angular length. Next is a curved needle. Okay, that is a Dhanu Vakrakar Suchi used at the vital areas like a marmas, testicles, and abdominal viscera. Suturing. Suture is a stitch or a row of stitches holding together the edges of the wound. Especially suturing is done when there is a surgical incision. Which are the needles? Needles should be sharp pointed structure used to puncture the tissue. Number one, ideal needle. Ideal needle is always made from high quality stainless steel. Number two, as the thin and slim as possible, the ideal needle should be without compromising strength. Ideal needle should cause minimal trauma to the tissue. Ideal needle should be able to penetrate the tissue with minimal resistance. Ideal needle should resist the abdominal bending. Now, here you can see the different types of the varieties of suturing according to the shape. You can see on the left side, straight, curved, single arm or double arm suturing. According to the cutting edge, round body needle, cutting body needle, conventional cutting, or the reverse cutting. According to the eyes, traumatic, that is with eyes, and atraumatic, that is eyeless. According to the tip of the needle, triangular tip, round tip, and blunt tip. Miscellaneous, spatula needle, and the micro point needle. So when we talk about the needle, it is related with the suturing in the Ashtavidha Karma. Now, what is the suturing material that one can use? Surgical suture is a medical device used to hold the body tissue together after an injury or surgery. Ideal suture material. Number one, It should be easily available and cost effective. Then that particular suture should not promote the growth of bacteria around it. Then suturing material should have the uniform diameter. Then suturing material should be non-allergic and non-carcinogenic. Now, suturing material, varieties, absorbable, non-absorbable. Then natural synthetic, here also natural synthetic. What is absorbable? It is absorbed in the body. It either gets digested by enzymes and removed by the phagocytosis, or it is gets broken down by hydrolysis and removed by phagocytosis. So, which are the natural things that are absorbable? Number one, catgut. Number two, collagen. Number three, fascial atta. Number four, corega. Number five, that is beef tendon. So, all these things are the natural suturing material and which is absorbable. Now, in the synthetic, you can see the vicryl or the vicryl, that is a polyglyctin, then dexone, that is polyglycolic acid, then PDS, that is polydioxazone, and polyglycarpone. But first two names are very important. Now we will see what is non-absorbable. Non-absorbable means it remains inside the body and retains its tensile strength for at least 1 year. So which are the non-absorbable material for suturing? Natural quota, silk, cotton, and linen. And synthetic, steel, nylon, silver, polyester, polyethylene, proline, platinum wire, and silver wire. So my dear friend, this is a very good and interesting chart to remember the suturing material. The major is absorbable and non-absorbable. Now here you can see the different types of the knots. This is called as a simple knot. Then this is called as a granny knot. Then this is called as a square or the reef knot. And last is the surgeon's knot. So these are the four varieties that you have to remember as the types of knots. Now, types of the sutures: simple, continuous suture. Simple, continuous suture. Can you see here? Next. Types of the suture. This is cutaneous and continuous suture. Cutaneous and continuous type of the suture. Then this is a subcuticular suture. Subcuticular. Below the skin, what they are doing and how they are doing this type of the suturing. Now, interrupted suture. For example, knots on some time inferiorly. These are the above, but sometimes it can be below, like this. This is a 0.5 centimeter, the length of that particular muscle. Okay. So, my dear friends, we are discussing the types of suture. This is a interrupted suture. Now, blanket continuous suture. Like a blanket, you can see very well. This is like a blanket. Okay. Next is a mattress suture. You have to just remember the figures, and at least few figures you are expected to draw in the LAQ question. This is mattress suture. So my dear friends, today's topic was very interesting regarding the Ashtavidha Karma, and we have discussed a lot about Ashtavidha Karma. In last few minutes, I will repeat these particular names of the Ashtavidha Karma. So let us have the Ashtavidha Shastrakarma names. Chedana, that is excising and removing. Bhedana, that is dividing or separating. Lekhana, that is scraping. Vyadhana, that is puncturing or piercing. Eshana, that is probing or searching. Aharana, extracting and pulling out. Visravana, that is draining. And Shivana, that is suturing. So again, 8 important surgical procedures mentioned in the Sushruta Samhita are Chedana, Bhedana, Lekhana, Vyadhana, Eshana, Aharana, Visravana, Shivana. Chedana, Bhedana, Lekhana, Vyadhana, Eshana, Aharana, Visravana, Sivana. So my dear friends, in each of these 8 points, I have given you the definition. What is the meaning of Chedana, Bhedana, etc. Then I have given you what you can say the Shastra and Anushastra, which can be useful for these 8 procedures. And lastly, I also told you about the Yogya, that what are the indications for these particular procedures. So this is all for today's lecture, and we will see you in the next video. Till then, I request all of you to like this video, share this video, and don't forget to subscribe my channel to boost the energy of Dr. Deshpande. Thank you very much. Take care and see you in the next video. Thanks a lot. Thank you. Take care. Thanks a lot. And I would like to stop this video. Here I am stopping. Okay, bye-bye.